Antibiotic resistance occurs when bacteria change in a way that makes antibiotic less effective or completely ineffective. This means that the drug that once killed the bacteria no longer works. The infection becomes harder to treat, and stronger or fewer treatment options are left. Gonorrhea is caused by Neisseria gonorrhea, a bacterium that is extremely good at developing resistance. Over time, gonorrhea has developed resistance to almost every antibiotic that once used to treat it. Because of this gonorrhea is sometimes called a superbug STI, sexually transmitted infection. Historically, gonorrhea was treated with penicillin, sulfonamide, fluoroquinolone, and tetracycline. Today, many strains of Neisseria gonorrhea has developed resistance to these drugs, making them ineffective. This is the issue that forced doctors to move to stronger antibiotics like ceftriaxone, which is still used today for treatment of gonorrhea. There are human behaviors that contribute to this antibiotic resistance, such as self-medication, wrong use of antibiotics or using the wrong antibiotic, sharing antibiotic, incomplete treatment, and buying antibiotics without prescription. All these things contribute to antibiotic resistance. This exposes the bacteria to sublethal doses instead of lethal doses. And when bacteria is exposed to sublethal doses, some resistant strain of Neisseria gonorrhea will survive and multiply. That is why antibiotic resistance is very harmful, and this thing I mentioned, this human behavior that contributes to antibiotic resistance should be avoided, such as self-medication, incomplete treatment, wrong use of antibiotic, or using the wrong antibiotics, or buying antibiotics without prescription. This should be completely avoided. Why antibiotic resistance is dangerous? When gonorrhea becomes resistant to antibiotic, treatment option is limited and infection lasts longer. The risk of complication increases, the transmission also continues, and healthcare cost rises. In the worst case scenario, the gonorrhea may be difficult to treat or impossible to treat. That is the implication of antibiotic resistance. So this drug resistant gonorrhea is increasing worldwide. It is international travels that help to spread this resistant strain of Neisseria gonorrhea. Health organizations consider this bacteria as a global public health threat. So because gonorrhea is common and can be asymptomatic, it is spread so easily without people knowing. That is shocking part of gonorrhea. When it comes to treatment of gonorrhea infection, ceftriaxone is the most reliable antibiotic for treatment of gonorrhea. Though when this antibiotic is misused or used in a wrong way, antibiotic resistance will tend to occur. That is why self-medication is dangerous. Wrong use of antibiotic or using the wrong antibiotic, sharing antibiotic, buying antibiotic without prescription, or stopping the treatment or half treatment. This thing can lead to antibiotic resistance. Ceftriaxone is antibiotic. You ought not to misuse it. You take a complete treatment, and you should avoid half treatment when it comes to antibiotic. You complete your medication to avoid development of antibiotic resistance. It is very important. So resistance might have been reported in other places, but ceftriaxone still remains the reliable antibiotic for treatment of gonorrhea. So it is more effective than other antibiotics in which the gonorrhea have developed resistance to. So that is the thing. To recap, ceftriaxone is antibiotic. Do not misuse it. So this antibiotic resistance can be prevented at the individual level and at the healthcare level. In healthcare level, correct diagnosis, guideline recommended therapy, and monitoring resistance should be ensured in order to prevent this antibiotic resistance. And when we comes to individual level, self-medication should be completely avoided. You should complete your prescribed treatment. You should get tested early, and you must ensure that your partner has been treated, has completed his or her treatment, so that we prevent the infection of gonorrhea. That is very important. When we come to antibiotic, you as an individual also have a role to play. This is by avoiding self-medication, sharing of antibiotic, using leftover antibiotic, or buying antibiotic without prescription. You just purchase antibiotic without knowing the uses, because you believe that it can cure this one, it can cure this one, proving yourself that you have the knowledge of medicines and drug. That is not proper. You have to know what you are taking in, especially when it comes to antibiotic, because bacteria is very good in changing. It can undergo antigenic variation, which lead to antibiotic resistance. So when we come to antibiotic, you have to be very careful and sure of what you are taking. Ensure you are correctly and accurately using antibiotic in question. So that's the thing. That's what I want you to understand. Do not play with antibiotic. Otherwise, treatment option will be limited. That is fact. And infection will continue to progress or become impossible to treat or very difficult to treat. That is the fact. Thank you for watching. If you find this video helpful, share to others, like and comment, and also hit the subscribe button. See you next time.